Thank you for joining us here today. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation. CPBF is a charitable organization, and our mission is to empower families of premature babies through support and education. This month, we celebrated World Prematurity Day. CPBF has joined the global call to act now, keep parents and babies born too soon together. As we know, the COVID-19 pandemic brought an extraordinary challenge to families of preterm babies. Neonatal units worldwide adopted strict safety measures that often separated parents from their newborns in the NICU. Studies have shown time and time again that separation between parents and babies can cause severe and long-term health and developmental issues in newborns and also affects parents' mental health in lasting ways. CPBF is advocating for every parent's right to have unrestricted access to their babies in hospital, no matter where and when. On November 17th, we brought this message on a big live event, a special edition of the Preemie Chats with guests from different parts of the world. If you missed the event, you can watch the recording on our YouTube channel. And this Preemie Chat series is one of the many initiatives we have to bring information for NICU families and healthcare professionals. Here every Friday, we talk with experts, researchers, and parents who share with us their experience and knowledge. Also on our website, canadianpreemies.org, parents will find all kinds of resources and support. And today we're going to talk about the brain, the dimensions of white matter injury in the preterm brain. White matter injury is a common form of brain injury in babies born preterm. Through advances in science and brain imaging, we now recognize several dimensions of white matter injury. An understanding of these different dimensions of brain injury is shedding new light into why this type of brain injury remains so common, why it matters for a child's development, and ultimately, how the outcomes of children with these brain changes might be supported. And I have here joined me live from Toronto, Dr. Stephen Miller, who is the head of Division of Neurology and the Center for Brain and Mental Health at the Hospital for Sick Children, professor of pediatrics at the University of Toronto, and senior scientist in the Neuroscience and Mental Health program at the Research Institute of Sick Kids. He holds the Bloorville Children's Hospital Foundation Chair in Pediatric Neuroscience. Dr. Miller and his team focus on improving the clinical care of newborns requiring intensive care, such as those born preterm or with congenital heart disease. Findings from his research program inform new strategies to promote optimal brain development and neurodevelopmental outcome. Most recently, he co-directs Child Bright, an innovative pan-Canadian network that aims to improve outcomes for children with brain-based developmental disabilities and their families through Canada's strategy for patient-oriented research. Dr. Miller, thank you so much for joining us here today.
Fabiana, thanks so much for having me, and congratulations on all of the important work of the Canadian Premature Babies Foundation. It is so impressive to see the initiatives you've launched and the support that you're providing for families and babies born preterm.
So I know you have a presentation that I'm going to share your slides with us. And for all of you watching us live on Facebook and YouTube, please do send your questions and comments, and Dr. Miller will answer them at the end of his presentation. Dr. Miller, the floor is yours.
Thank you. So we are going to talk about white matter injury, which is perhaps the most common form of brain injury in babies born preterm, something that affects at least a third of the babies who are born very preterm, so less than 32 weeks gestation or under 2 months of age. Fabiana, this is a topic that you and I have spoken about over many years. And in preparing for this talk, I went back over a presentation that I gave on white matter injury over 5 years ago. And it is so impressive to see how the science has really changed our understanding of the brain. And when I say science, I'm going to share science from the lab, from my colleagues who are working with experimental models. I'm also going to share our experience working with children and families in the intensive care unit and beyond. And before discussing any of those findings, I want to start by thanking the families who have participated in this research, often over many years and over very stressful periods of time. And the only reason that we have an update now on white matter injury is because of their efforts working with researchers. So on behalf of the entire research community, thank you so much. I also want to start by saying that when you hear about brain injury, when a neurologist comes into the room and starts talking about white matter injury, I understand how stressful that can be. And I think one way to help us with that stress is to be very deliberate about understanding what it is we're talking about. And the best way I can think of doing that is by sharing with you our understanding of white matter injury, really from the perspective of a clinician scientist. So we are going to delve deep into the details of this, and I'm going to count on you through comments or chats to Fabiana to make sure if there are issues that remain unclear, that I know what those are so that I could better describe them, because we are going to delve deep into the science, because this is where the most exciting advances are happening. And based on the title, I also want to highlight that there are many dimensions of white matter injury. And the message that I have today is that by understanding the different dimensions of white matter injury, we actually have much more hope to be promoting and supporting the outcomes of babies who are impacted by this type of brain injury. So I have no disclosures that are directly relevant to the science that I'm going to be sharing, and I'm going to ask Fabiana for help just moving the slides forward. So if we go one more slide, I show these images to highlight that this is really about children. While everything else that follows is going to be brain scans, ultrasounds, MRI scans, images from laboratories, what we're really driven by is understanding how white matter injury influences the brain and how we could then overcome that influence so that a baby born preterm with white matter injury develops as well as a baby born without white matter injury or their peers born full term, and thrives and flourishes in all aspects of their development. So if we go to the next slide, our brains make us who we are. And neurologists thinking about the brain, it's helpful to recognize that the brain contains hundreds of billions of neurons, nerve cells, that form trillions of connections. I find this to be an absolutely incredible image from my colleague at King's College in London, England, the Center for the Developing Brain. This is a diffusion image of the brain of a baby born preterm, imaged with MRI non-invasively at 32 weeks of age. And I don't know if you could show that video again, but through the Developing Human Connectome project and very sophisticated ways of looking at how water is diffusing in the brain, Dr. Council and her colleagues can map out all of these different connections in the brain. So fibers that are connecting the nerve cells from the surface of the brain to the deep structures of the brain that are moving front to back in this image are in green. The vision pathways, for example. Up and down in the brain are in blue, so we could see at the top of the image our voluntary motor pathways, the corticospinal tracts running down to the spinal cord to control our movements. And then right to left in the brain in red, you could see right in the middle of that image, the corpus callosum, those connections between our two hemispheres of the brain. So I use this image to highlight that while I'm going to focus on white matter injury, these connections, the brain is a connected organ. And so it's very hard to distinguish the gray matter structures, so the cerebral cortex or the surface of the brain, the basal ganglia and the thalamus, the gray matter deep in the brain that are the brain's relay stations, from the white matter. The white matter is the connections between these gray matter regions. Why do we call the white matter the white matter? Well, we do so because in the adult brain, the mature brain, after 2 years of age, when you look at the brain, these connections are white because of a fat that is insulating each of these fibers that are imaged on this picture. And that fat is called myelin. And I'm going to come back to myelin shortly. When we think about white matter injury, it is an injury to these connections in the brain. Next slide. So if I think back to my days training as a pediatric neurologist, if you said white matter injury, I would think of a condition called periventricular leukomalacia. I think one more click will bring up the words so people can read them. Oh, let's go back. They're not showing. You'll have to believe me that if we go backwards to that slide with the ultrasound, one more, perfect. PVL, or periventricular leukomalacia, refers to an injury to the brain's white matter that is next to the ventricles. So it's periventricular, leuko for white, malacia for softening. This is a sagittal ultrasound image where you could see the front of the brain, the back of the brain, and the white matter should look like the gray up top of the black of the ventricles, the normal fluid-filled spaces. And while it looks like a TV screen, those old black and white TVs that's out of focus, I think that we can all make out these dark areas, these circles, throughout the posterior part, the back part of the white matter. And those are the cysts that are the hallmark of periventricular leukomalacia. And I bring this up because as a neurologist, children with a significant amount of PVL would come to the neurology clinic with concerns of spastic diplegic cerebral palsy, cortical visual impairment, and concerns with cognition. Now, when I went to train in neonatal neurology with Donna Ferrero at the University of California, San Francisco, the research that I had planned to do was focused on understanding how PVL led to these concerns in a child's development. So what was happening in the brain? We started working with families and children who were born preterm in the intensive care unit and doing MRI scans shortly after they were born, and then again at close to their due date, to understand how the occurrence of PVL influenced this period of brain development over their course in the intensive care unit. What came as a surprise to us is after working with over 100 families of babies born very preterm, none of the babies on MRI had evidence of PVL. And so we wondered what happened to PVL in this intensive care unit. Was it just that we weren't seeing these babies in the study, or had something in the incidence of PVL really changed? So I was fortunate to work with Shannon Hamrick, now a neonatologist at Emory, and with the radiologists and ultrasonographers who had been in this NICU for many decades. They were rigorously doing ultrasounds in these babies serially over their intensive care unit stay. And the only thing that had changed from the 90s into the early 2000s is that the ultrasound machines got better. And so you would have thought we would have picked up PVL even more frequently now that we had a better tool to examine the brain. But instead what we saw was that the incidence, the occurrence of periventricular leukomalacia had this dramatic decline. It had decreased from 2% annually in the intensive care unit for all preterm admissions under 32 weeks gestation to 0.2%, a tenfold decline in the most serious form of brain injury in babies born preterm. Now, we thought that that was striking because there was very little that was being tested in the lab in those days that would have accounted for a 10%, a tenfold reduction in brain injury. Not a 10%, but a tenfold, 2% to 0.2%. So we worked with our epidemiology colleagues, David Glidden in biostatistics, to link this decline in PVL to a more general use of mechanical ventilation. And this study to me was eye-opening, because it suggested that if we could deliver intensive care in ways that were optimal for the brain, we might see ongoing declines in the incidence or the occurrence of significant brain injury. Next slide. As we moved from ultrasound as our testing tool to MRI, we recognized, though, that while we saw this dramatic decline in PVL, and I should tell you that Linda de Vries and her colleagues in Utrecht had shown that they saw a similar decline in PVL, and they took the extra step to show that their incidence of cerebral palsy had also decreased over this time period. So a really important change in PVL. We weren't seeing the same change in milder forms of white matter injury. These milder forms of white matter injury occur in the same distribution as PVL, but they're not well seen by ultrasound. You really need to do MRI scans, and typically MRI scans earlier in life, as opposed to at term equivalent age, to pick up these changes. And so shown here is another sagittal MRI image. We're looking on the MRI, you can make out the eyes in the front and the mouth. We could take that to the back of the brain. The cerebral cortex is a beautiful ribbon of gray, underlying lighter gray, overlying darker gray. So again, billions of neurons. As the neurons make trillions of connections to make room, they start to have sulci and gyri. So this brain we know is maturing. And we see these very bright spots in the white matter, these punctate little lesions that are the hallmark of white matter injury of prematurity. We find these changes in about a third of babies who are born 24 to 32 weeks gestation. Now, these lesions are best seen on MRI scans in the first weeks of life, and over time they fade. And as they fade, that area of tissue, those punctate areas of tissue are lost, and so they become very hard to see by the radiologist. Now, I'm showing you this one change. I'm going to ask Fabiana to go to the next slide. Because here we're looking at the brain now in an axial orientation. It's as though we've taken a slice off the brain and our skull and are looking down on the brain. And you could see in the first image on the left-hand side of your screen that this baby just has a single punctate dot of white matter injury. This is minimal white matter injury, one little spot. On the other side, you see another bit of brightness on this axial image, and I'm sorry to not have a pointer to do this directly. That's a little bit of bleeding in the ventricles. We've talked about intraventricular hemorrhage in the past. We're going to focus on that punctate spot. You could see in another baby born very preterm, this baby has many more spots, more moderate white matter injury. And then we get to the other side, on the right-hand side of the image, a third baby who has cystic PVL, accompanied by these bright spots. And I show you this to highlight that there is a spectrum of this change. And fortunately, most babies that we see with white matter injury are on the much milder end of the spectrum, these minimal areas of punctate white matter injury. So if we go to the next slide, we've wanted to know, do these injuries matter? As a neurologist, I grew up understanding that the baby brain is, in quotes, plastic, that there's reorganization and recovery from injury to the brain. And I think that that's true to a degree. So as we look at this white matter injury map, this is work done by Jessie Guo, an MR physicist with my team at Sick Kids. She mapped out the occurrence of all of these punctate little white matter lesions from a group of over 225 babies born very preterm that were imaged with MRI early in life and at term equivalent age around their due date in Vancouver. And another shout out to the families who have participated in these studies over such a long period of time. We see that these punctate white matter injuries are periventricular, so they're next to the ventricles and really limited to the white matter, most often right in the middle of the brain, those central regions, important for motor control. Do they matter? So here we've now converted the same map into an odds ratio, some measure of risk for a motor outcome defined here by the Bayley Scales of Infant Development 3, a standardized measure of motor development, has a mean of 100, standard deviation of 15. We could see that white matter lesions that are predicting lower motor scores are happening more in the frontal part of the brain, more anterior. And the same for cognitive concerns. So note that the white matter lesions are stronger predictors of motor changes as opposed to cognitive changes. And that's reflected by the warmer colors on this curve. If you go to the next slide, Dalit Kayam-Rand, a neonatologist now at Shaare Zedek Hospital in Jerusalem, said those quantitative images may be very nice to look at, but they're very hard to implement for a neonatologist at the bedside. So if the anterior lesions, the lesions towards the front of the brain, if those are more important for outcome, what if we just develop a very simple rule? We're going to take a line and put that line across the ventricles of the brain. And we're going to ask, are the lesions behind the line or above the line? With the idea that if the lesions cross the line, we have to be more concerned about the child's neurodevelopment. And you can see on these two images, we have both what looks like a similar amount of white matter injury, but the baby whose changes are behind the line has no concerns on neurodevelopmental outcome, and the baby with the changes in front of the line return to follow up with concerns in their motor outcomes. And this is extended out now to 4.5 years of age. We could look at the volume of these lesions versus the location of these lesions, and the location tells us even more. Now, if you look at the column that says accuracy, let me also point out that these are not 100% accurate tests. And so I hope we approach these predictions of outcome with enough humility to recognize that we don't have a perfect test. Even when we combine MRI findings and clinical findings together, there is still some variability in how children develop. And let me explain why that might be. To the next slide. In all of our other interactions through these live sessions, I've highlighted how the brains of preterm babies are undergoing this absolutely incredible period of brain development over the time that they are cared for in the intensive care unit. This is a different kind of MRI image, a T2 image, that's showing us, I think, this development very nicely. You could make out the ribbon of the cerebral cortex, this dark band that's relatively smooth on this MRI image at 32 weeks gestation. And then if we look at 39 weeks gestation, it's now lumpy bumpy because all of these neurons are starting to make connections. And the white matter, it looks bright towards the middle layer of this image. So a dramatic period of brain development over the time that this baby is being cared for in the intensive care unit. So let's take another look at white matter injury, but with the lens of this rapidly developing brain. Next slide. So we have to ask, why is the white matter so vulnerable to injury in the preterm baby? It still strikes me that this change in the brain, this type of injury, is far too common. And the reason that is, it's because the cells that live in the white matter over the 3rd trimester of gestation are just exquisitely vulnerable to injury. So I told you the white matter is white because of the fat that insulates all of these nerve connections. And that fat is called myelin. And myelin is formed by these amazing cells called oligodendrocytes. These are a glial cell. So we often, neurologists like to talk about neurons. We like to think about neurons, those nerve cells. But just as important are the glial cells, the supporting cells of the brain. And one glial cell is the oligodendrocyte. It starts as a stem cell, becomes a progenitor cell, and then it becomes this pre-oligodendrocyte. And this pre-oligodendrocyte is super vulnerable to hypoxia, ischemia, or energy deprivation. And so one more slide, we'll just put up the cartoon around that cell. When that pre-oligodendrocyte matures to become an immature oligo, these oligodendrocytes start to wrap around axons. Each cell, tens or hundreds of axons start to get affiliated with them. And then it puts down the fat of myelin. These immature oligos and mature oligos, very hard to injure. But the pre-oligodendrocyte is vulnerable to injury. And it is the cell type that predominates in the white matter at 28 weeks gestation. And that is why white matter injury is most common at that phase of development, not at the most extreme weeks of prematurity or closer to term age. We could see white matter injury in these babies, but it's really in the very preterm baby because the cells that are living in the white matter are exquisitely vulnerable. Let's go one more slide. And I'm going to explain why this vulnerability is actually a source of hope. So if we look at the modern spectrum of white matter injury, I've shown you PVL. It's shown here as 8% because at a volume level, when you have it, it accompanies a large volume, even though it's very rare. Micronecrosis refers to those punctate white matter lesions. You could see on the cartoon on the right, those blue little lesions. But if we actually look at the brain, the most common form of white matter injury is what I'm going to term diffuse white matter injury. These areas that surround those punctate lesions that fail to develop myelin, that fail to have the fat that's going to insulate the fibers to allow for effective neurotransmission. And from everything that I've told you, we should have predicted that in areas of diffuse white matter injury, the most common form of injury in babies with white matter injury, that those cells should have been lost. But in fact, they're not. Let's go one more slide. This is a game-changing study by Stephen Back and his colleagues. Let's go back one so I could show you the primary data. Steve Back is now at OHSU in Portland. Let's see if we can go back one. Oh, back two. Well, we get to the numbers. In areas of diffuse white matter injury, the pre-oligodendrocytes actually go up. They're not lost as we might have predicted. So there is a phenomenon in areas of diffuse white matter injury. Again, the biggest issue we need to address. Pre-oligodendrocytes get upregulated. There's a natural recovery. But they fail to mature to become those immature oligodendrocytes. And that is why we don't end up with enough myelin to recover from this. These pre-oligodendrocytes are getting stuck. They face a roadblock. And they're failing to mature to become immature oligodendrocytes. Let's go one step forward. So when we have hypoxia, a lack of oxygen, or ischemia, a lack of blood flow, we have small areas of injury, those punctate white matter injuries, and what's in those bright little spots, the cellular elements there are lost. But we're most concerned with is diffuse white matter injury. And there we have this pre-oligodendrocyte renewal. Too many cells, but they get arrested in their development. So why do I say that this observation offers hope? Let's go one more slide. Is that Steve Back and his colleagues, and I'm sorry that, oh, there you've got the reference. This is work that is progressing at a furious pace. They now understand that this roadblock is not something to do with the neurons or the glial cells. It's actually to do with the extracellular matrix, hyaluronic acid, the stuff that holds all of the brain tissue together. And what Steve Back and his colleagues have shown at OHSU is that you can alleviate this block by targeting hyaluronic acid. And you could look at the brain labeled control. This is in a mouse brain. And then the treated brain, and notice how the green band is very similar in both of those brains, whereas it's lost if you don't have the hyaluronidase inhibitor. So by starting to appreciate that this injury isn't a fixed issue, but instead a block in maturation, something we call dysmaturation, we can now start to look pharmacologically, how can we overcome this roadblock and promote repair? Let's go one step forward. And the goal of promoting repair is to enable this amazing connectivity of the brain. And I'm just going to show you one slide to show how this connectivity becomes important as a predictor of motor skills and cognitive or thinking skills over time. We can go one slide forward. Because I think it's not just how many spots you have on the MRI scan, but it's how this connectivity is developing over time. And if we take this one step further to the next slide, let's bring it back to this baby whose MRI scan I showed you at 30 weeks, and then again 9 weeks later, just before their due date, and then again 8 years later. The brain undergoes these unbelievable transformations across the neonatal intensive care period and then through childhood. And so the other active areas of investigation, our team and others in the intensive care unit with follow-up programs, but very importantly through basic science labs, trying to understand how we can promote this incredible period of brain development through childhood and restore or enable the connectivities that allow for those connections between the nerve cell areas, the cerebral cortex, the basal ganglia, the thalamus. And so if we go to the next slide, as we look at different dimensions of white matter injury, I think the next years will bring multiple new opportunities to promote the health of the developing brain. And so I'm going to bring us to our final slide so we could pause here and take some questions. But I again want to thank the families who participate in these studies and the children who participate in these studies, often coming back for follow-up many years later, because that's the way we're going to understand the outcomes that matter most to the families who are participating in these studies. I want to thank my team at Sick Kids and collaborators in Vancouver and elsewhere, our sources of support for allowing this work. And Fabiana, I will turn it back to you so that we can have some discussion.
Dr. Miller, thank you so much. I'm sharing your lab website here. People want to take a screenshot. There's lots of great information there. But thank you so much for, wow, that was like a med school class for parents. Amazing to understand, really understand the brain a little bit better, especially for us parents who actually have kids with white matter injury. So thank you for really shedding the light for all of us. So I guess my first question to you is in terms of when you talk about maturation and the pharmacologic interventions, is this going to be done or is already being studied at what age?
So the intervention that I showed you here is being studied now in experimental models or animal models. It's still several steps away from getting to babies in the intensive care unit. There are other approaches using the same types of approaches for other diseases that are affecting older people, like multiple sclerosis, that I think our neonatal community is going to learn a lot from. And there have been other studies of medications to promote brain repair in preterm babies, like erythropoietin, that didn't have the intended effects in babies. So I want to be sure that I'm cautious. While I'm very optimistic that we are going to have many new approaches for the developing brain, because we've moved our attention from the injury that happened to how do we promote recovery, how do we promote connectivity. That's opening up many new avenues. It's still many steps away from human studies.
Okay, so just to step back a little bit, because you said, you know, the white matter injury cannot be seen in ultrasound image. As you showed, there was a normal ultrasound, but then you see in the MRI. And MRI is not a standard of practice in Canada as far as I know, unless things have been changing. So if you don't see the injury through an ultrasound, when do you start seeing signs of there is some injury in the brain, and for the time you do the MRI and you can possibly have an intervention?
So I think the issue of MRI scans for babies is certainly a controversial one. And I could share my experience is that we use MRI scans much more frequently. And while this presentation isn't to promote routine use of MRI, we use MRI routinely when it's going to help families understand what happened to the brain. And so MRI can now be done safely. It's accessible at many centers, but I think it's it's an individual approach as to when is the information helpful. And for some families, that's not helpful. And for other families, it's very helpful. So there isn't a one-size-fits-all for this. The concerns that come up clinically often take months or years to manifest. And so there's a lot of other work that's looking at things like general movements. I know you've had sessions on that to try to pick up concerns early on. And sometimes the concerns only appear later in life as children are approaching school age. And so it's very hard to give a specific answer because we have to be sensitive to, depending on the severity of the change in the brain, the timing of when concerns can arise can be different. Now, I've also shown some evidence that not all of these injuries appear to be having concerns. And so, I want to be very careful that as even the way we frame the question, and I started framing my response, right? Injury to concern. We can also use MRI to be more refined to know who needs reassurance. And I think I'm more often able to give reassurance in the NICU by understanding what happened to the brain than I have to worry families. And that's quite different. I reflect back on with regret at the times where I've been concerning when I should have been reassuring. And I think that's been a really important facet of the studies and has really emerged from listening to families, is looking for opportunities to use this information to provide reassurance.
Right. And you and I have talked about this many times. When do you reassure families, or when do you actually, families are more concerned, and what do they have to do about it? So from my understanding, well, we talk about IVH in the past, and you talk about early interventions that could, maximize the child's potential. So with white matter injury, is it a different approach, or parents should be proactive from the beginning to optimize the development of the child, even if there was nothing shown on an ultrasound? Proactive.
And if that's the only thing people hear from this conversation today, I feel like it was a success. I think when we think about how rapidly that brain is developing and how it's developing in ways that we still need to understand, there's overwhelming evidence now that a supportive environment helps to promote how the brain is developing. And I would suggest that that's even more important when you know that there's been some injury or even stress on the brain. In the past, we've talked about pain, analgesia, sedation, nutrition, all of which intersect to provide opportunities to actually promote and support brain development. Working with Ruth Grunau and Ancinis in Vancouver, Isabel Benavente Fernandez in Cadiz, Spain, and our colleagues around Vancouver for this study, when we looked at the outcomes of babies with these white matter injuries, and we start to look at the outcomes based on the socioeconomic status of the families. And here we operationalize socioeconomic status based on mom's education. It's not about the moms. This is just about one measure of socioeconomic status. You find the same things if you look at household income or if you look at dad's education, but mostly moms come back to follow-up clinics. The amazing observation that those babies in the highest SES tertile, in the highest SES group, the white matter injury wasn't predicting a lower IQ scores at 4.5 years of age. So to me, that's a call to action to all of us. What's happening in those homes that are mitigating the influence of brain injury on outcome? And how do we learn from that to support all children?
Okay, so one question that we have about Child Bright, one of the projects in Child Bright is being studied the use of metformin for white matter injury. Can you talk a little bit about that and what is happening and what are you expecting from that study?
So metformin, it's a great question. Metformin is a drug that's commonly used for diabetes that Frida Miller, a neuroscientist at Sick Kids, now at UBC, discovered that if you give metformin early in life, it enhances neuroprogenitor cells. Now, I've mentioned that the main issue here is oligodendrocytes, but I also mentioned connectivity. And so the hope is that metformin, provided later in life, it's approved for use, and I don't quote me on this, I think it's above 6, given later in life to children with cerebral palsy will enhance this recovery. And Dawn Mabbitt the co-principal investigator in Childbright with Darcy Failings at Holland Bloorview, has evidence in children with brain injury following treatment for brain tumors that it enhances children's outcome and the brain. So we're going to have to learn more from the findings of that study to know whether there is a role for metformin in the treatment of children with cerebral palsy. But to me, it's another example of how we've shifted the lens from this being a fixed, static issue to really thinking that maybe there's opportunities to promote brain development.
Oh, absolutely. Dr. Miller, thank you so much for joining us here today. Always great talking to you, learning from you, and understand what is in the horizon for our family. So thank you so much for joining us.
Thanks so much for having me, and thanks for the slides.
Thank you. And to all of you watching us live on Facebook or YouTube channel today, thank you so much for joining us. And the video of today's session and all the videos from our live series are available on the CPBF website, which is right here, the CanadianPreemies.org. And I want to thank our sponsor, AstraZeneca and Water Wipes, for their ongoing support of our education sessions. And we are a charitable organization, and we believe that through education and support, we can empower families, ensuring they are ready to care for their premature babies. Visit our website, consider making a donation. Together, we can create a brighter future for all our families. And I see you again next Friday, 1 p.m. Eastern Time. Stay well.